Post-mortem care is the care given to a newly deceased patient preparing the body for funeral home. The first thing to do is to verify the patient's chart for certification of death. Because post-mortem care cannot be done not until the doctor pronounced the patient's death. And then ask for permission to the family members. Remove the belongings of the patient. And then after that, we have to prepare the materials. In this case, I've already prepared the materials. And then put on some gloves for safety. Next is we have to drape the patient. And it's very important to treat the body respectfully throughout the process, so we still have to give the patient's privacy. And then we can proceed to giving the patients a bed bath. And then we have to put cotton balls in the eyes, nose, and ears of the patient because it will absorb the body fluids of the patient. Put on some crayon on the jaw and tie it to the head of the patient to prevent stiffness. 15 to 20 minutes will do. Put on some name tags on the patient's hand, feet, and the bug. After verifying the doctor's order, the first thing we have to do when we face the patient is to identify ourselves. And then identify the patient, ask for his name, age, and birth date, and check it in his identification band. And after that, we have to explain the procedure to the patient. After that, we can go on now to prepare the materials. Hot application is the therapeutic use of heat in the body parts. It promotes blood flow, reduce pain, and relax the muscles. To prepare, we have to put A warm water in the patch and set it aside for a while to lessen the heat until the warmth can be bearable. While waiting, we can now put some cloth beneath where the pain is located at to prevent leaking it into the bedside of the patient. We can now apply the hot applications in the patient's pain site. We can now remove the hot applications in the patient's arm. Reassess the patient's arm. After verifying the doctor's order, you can now introduce yourself to the patient and then ask his name, birth date, and age, and then compare it to the identification badge for confirmation, and then explain the procedure to the patient. Assess the injured site, and then prepare the materials. Cold application is the use of hot temperature to reduce inflammation, numb pain, and slow blood flow to an area. It is used in injuries such as sprains, strains, and bruises. The difference between the hot and cold application is that the hot application is used to increase blood flow, relax muscles, and relieve pain or stiffness, while the cold application is used to reduce blood flow, decrease swelling, and numb pain. After preparing the materials, you can now place the cold application in the patient's arm. After that, we can now remove the use cold application and then reassess the patient's arm.